So you are called to high school in the band hall for a 15-year-old female with a possible asthma attack.
Okay, PPE, is my scene safe?
Scene is safe.
Is this my only patient?
Yes.
Her nature of illness?
Respiratory. She's having difficulty breathing.
Okay. At this point, I would call for ALS, and I would consider C-spine later, but at this time, I do not need it. So what's my general impression of them walking up to her?
You have a 15-year-old female sitting on the ground having difficulty breathing, and she is anxious.
Okay. Hi, my name is Katie. I'm an EMT. What's your name, and what seems to be the problem today?
My name's Kelsey, and I'm having difficulty breathing.
Difficulty breathing? Okay, so she is alert, and she has a chief complaint of difficulty breathing. Her airway is patent, so I would not consider anything. For breathing, how's her breathing looking like?
You can hear some audible wheezing on inhalation. She's breathing tachypneic, and she has shallow breathing.
Shallow? Okay. At this point, I would put her on a 50-meter normal breather mask. Okay, and then for circulation, I'll look for her pulses. How are her pulses?
Her pulse is tachycardic, and she has a bounding pulse.
Okay. Her skin looks normal.
Her skin is actually pale, cool, and moist.
Okay. And any major bleeding?
No bleeding to know.
Okay, at this point, I would consider her a priority patient, and I would transfer her code 3. So now we'll go into my OPQRST. What was happening when this started?
She was marching at band practice.
Marching, okay. Does anything make it better or worse?
No.
Can you describe it for me?
I just feel like I can't breathe.
Okay. Does it radiate anywhere?
No.
Okay. Severity 1 through 10, 10 being the most pain you've ever felt, 1 being the least. What would you rate this as?
It's a 9. I feel like I really can't breathe at all.
Okay, and then what time did this start?
It started about 15 minutes ago.
Okay. Have you ever had this before?
No, I've never felt this before.
Okay. So I'll go into my sample. Are there any other signs and symptoms besides her respiratory distress?
No.
Okay. Are you allergic to anything?
No.
Okay, do you take any medications?
I have an inhaler in my bag, but I've never used it before.
Okay. Do you have any past medical history?
Just the inhaler that I have for asthma.
Okay. What was your last oral intake?
I had lunch about 4 hours ago.
Okay, and what was the event leading up to this?
Again, I was just marching at band practice.
Okay, so for my secondary assessment, I would consider her to be having some kind of respiratory issue. So when I'm popping the hood, I'm going to be looking for any kind of redness or rashes. I would be listening for lung sounds, and I would listen for it here, 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 and on the backside as well.
So when listening to the lung sounds, you find a wheezing on exhalation that is happening bilaterally.
Okay, so at this point I will take vitals. So I will go ahead and take her pulse first.
Pulse comes back at 120 beats per minute.
Okay. So now I'm going to listen for respiratory quality, and I will check her rate as well. So what's her respiratory quality?
Quality is okay. You just find some wheezing upon exhalation. She is breathing at 28 breaths per minute.
Okay. Now I'll go do my blood pressure. Okay, I got her at 118/78.
That's good.
Okay, so I will go into my field impression. So I believe that she's having some kind of asthma attack. And for interventions, I've already given her 15 liters through a non-rebreather mask, and I will help assist her with her inhaler. For my reassessment, I would reassess every 5 minutes because she is a priority patient. And I would reassess her vitals, like specifically her respiratory rate and quality. And I would reassess whether her pain scale has gone down. So now I shall do my verbal report. This is Kelsey. She's a 15-year-old female. She has a chief complaint of wheezing with respiratory distress. Her vitals are 120 heart rate, 28 for her respiratory rate, and 118/78 for her BP. I've given her 15 liters through a non-rebreather mask, and I've assisted her with her inhaler, which should be there in 5 minutes. That's my skill.
Cool.
Yay!